Hi everyone, and in this video I'll be discussing important colony stimulating factors. So colony stimulating factors are used as drug preparations because when you use anti-cancer therapy, there is a risk of bone marrow suppression. The WBCs will come down, RBCs will come down, platelet will come down. That time we use these colony stimulating factors. So we'll be discussing this topic again in anti-cancer therapy. So it's just a brief overview in this colony stimulating factors. Now let me write. So the first one is GM CSF analog. So what is GM stands for granulocyte monocyte colon stimulating factor. What is the drug name? The name is called sargramostim. So you read the name. Gra means granulocyte, MO for monocyte stimulator. One more drug is molgramostim. So these drugs are used where? They are used to treat leukopenia due to anti-cancer drugs. These are GM-CSF analog. The name is sargramostim and molgramostim. Then we have GCSF analog. G stands for only granulocyte colon stimulating factor. The analog name is filgrastim. It is called as filgrastim. Now if you add a PEG for this, we get one more drug and that is called pegfilgrastim. The advantage of adding a PEG is to make the drug longer acting, that's it. One more drug similar to that is lenograstim. So you read their name, gra for granulocyte, stim for stimulator. Now where do you use them? We use them in a case of febrile neutropenia. So when we use anti-cancer therapy, there is bone marrow suppression, patient is susceptible to infection and there is a risk of febrile neutropenia, or a patient is having agranulocytosis, or patient is having leukopenia due to anti-cancer drugs. So there we can use this drug filgrastim, lenograstim. Then we have erythropoietin. We all know that erythropoietin is secreted from the kidney. The preparation of erythropoietin are two. One is called E-poietin. You know that it ends with poietin. They have taken E from here. So E-poietin. So we have the E-poietin and one more poietin is darbepoietin. So that also ends with poietin. Now where do I use this erythropoietin preparations? Number one, anemia in CKD patients. So chronic kidney disease patients, the erythropoietin synthesis decreases. There to correct that we use it. Or anemia due to drugs, due to two important drugs, the anti-cancer drugs, and anemia due to zidovudin. So zidovudin is an anti-HIV drug. So when we use anti-cancer drug, there is decrease in RBC production. Zidovudin can also produce bone marrow suppression. To correct that, we use erythropoietin. Now when we use erythropoietin, it will increase the reticulocyte count so that the blood become thicker. So it can increase the viscosity. Because of that, the adverse effect what we face with that is it can increase the risk of thrombus formation. You know the Virchow's triad. Increase in viscosity can also lead to clot formation. And since there is increased viscosity, the BP can also increase. So there is a risk of hypertension when we start erythropoietin. This has to be absorbed when we are giving erythropoietin to the patient. Then we have another drug. The name is called PEG. It is called PEG in acetide. So in pharmacology, anything ending with tide is a peptide. What is ESA stands for? ESA stands for erythrocyte. S stands for stimulating agent. Now, this agent is used to treat anemia in CKD patients, chronic kidney disease. So it is, you read the name, ESA stands for erythrocyte stimulating agent. Now, whenever we use anti-cancer therapy, there is a risk of platelets coming down. So how do we work out, how do we increase platelet? So we use interleukin 11 analog. So we have an interleukin 11 analog. The name of it is called Oprel. You know April, this is Oprel. Oprel Vakin. And we use this Oprel Vakin to treat thrombocytopenia due to anti-cancer drugs. Okay, so the name is Oprel Vakin. It's an interleukin 11 analog which can increase the platelet count. Since I am discussing platelet, I want to discuss certain drugs used in idiopathic thrombocytopenic purpura. And we have two drugs. One is called romiplostim, and one more is called L-Trombopag. So we have romiplostim and L-Trombopag. Romiplostim is given IV and this is given oral, and they are used to manage idiopathic thrombocytopenic purpura. And what is the mechanism? They both stimulate a receptor called thrombopoietin receptor. So let me write the full form of that. So these are thrombopoietin receptor agonist. So you read the name thrombo. So thrombopoietin receptor agonist. And you read like this: platelet stimulator, romiplostim. So these are the drugs used for ITP. So this is a brief video to just give you some of the important drugs in the management of leukopenia, neutropenia, in the management of anemia, as well as thrombocytopenia. Thank you all.